why a differential diagnosis is very important in diagnosing a heart attack in women. Hello, I'm Marcus Boston.
And I'm Renee Boston.
And we are both medical malpractice attorneys practicing law in the state of Maryland. And today we would like to talk with you about why a differential diagnosis is very important in diagnosing a heart attack in women. And for more on this, we have Renee.
We were recently contacted by a family of a 40-year-old woman. This woman started experiencing different symptoms, so she checked herself into the emergency room. She started complaining originally about jaw pain and neck pain and things like that, and also started complaining about being lightheaded and dizziness and having shortness of breath, and also abdominal pain. She was discharged from the hospital with a stomach bug, and the next day was admitted back to the emergency room with a massive heart attack.
Now you're probably wondering, what is this differential diagnosis thing that I was talking about earlier in the video? And what this is a differential diagnosis. What it does is it prevents doctors from guessing as to the diagnosis of their patient. And how it works is the doctor will come in and review the patient's charts and listen to the patient's complaints, and either in the doctor's mind or on paper, the doctor will list the diagnosis that fit with the patient's complaints and what the information is in the patient's chart. The doctor will go ahead and they will list these possible diagnoses with the most severe first, and they will work their way down to the less severe. Doctors will then order tests to either confirm or rule out the possible diagnosis. The reason this is important is because it prevents the doctors from guessing as to what the patient's final diagnosis is. And when your doctor is guessing as to what is your diagnosis, your doctor is then needlessly endangering you. Now, we realize that if you're watching this video right now, you probably have questions, you have more concerns. You may be wondering, was your heart attack misdiagnosed because your doctor did not pay attention to the signs that were there? You may be a loved one watching this video right now, and you may be wondering, was your loved one's heart attack, could that heart attack been prevented if your doctors or if your loved one's doctors had taken the time to listen and view the signs that were there? If you have these questions or concerns and your matter happened here in Maryland, this is what we invite you to do. Go ahead and pick up the phone and give us a call. We can be reached at 301-850-4832, or if you prefer, you can send us an email to medicalinjury@bostonlawllc.com. We answer questions like yours all the time, and we'll be glad to listen to your story. Well, guys, that's it for today's short educational video. Again, I'm Marcus Boston.
And I'm Renee Boston.
And we are both medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Guys, take care and enjoy the rest of your day.